Pharmacology for mental health disorders, assessment, innovation and evaluation in social work practice. My name is Ajibolu Taiwo Balofin, and I am from Grand Canyon University. This presentation covers key medications and alternative interventions for major mental health disorders, which includes the following: anxiety, bipolar, mood, personality, schizophrenia, trauma, anxiety disorders. Bipolar and mood disorders, personality disorders, schizophrenia spectrum disorders, trauma and adjustment disorders. NASW ethical responsibilities slide: limitations of medications for schizophrenia, alternative treatment for schizophrenia, evaluation and conclusion. Anxiety, bipolar, mood, personality, schizophrenia, trauma, anxiety. I'm going to touch bases on this. For anxiety disorders, the primary medication is sertraline, Zoloft, as SSRI. It works by increasing serotonin levels in the brain to regulate mood and reduce anxiety symptoms. Take it once daily, usually in the morning. And secondary is venlafaxine, Effexor XR, and SNRI that boosts serotonin, non-repinephrine. Tertiary is Bospar, which acts on serotonin receptors for non-addictive long-term use. An alternative is cognitive behavioral therapy, CBT, which help clients refrain from negative thoughts effectively. Bipolar and mood disorders. For bipolar disorder, lithium carbonate, Litobid is the gold standard mood stabilizer. It helps prevent manic and depressive episodes and reduces suicide risk. Monitor blood levels regularly. Secondary is valproic acid, Depakote, which increases GABA activity. Tertiary is quetiapine, Seroquel, an atypical antipsychotic. The alternative interventions is interpersonal and social reading, a therapy which stabilizes daily routine and relationships. Now let's talk about the personality disorders. Personality disorders often use fluoxetine, Prozac, and SSRI as primary to manage co-occurring depression and anxiety. The secondary is lamotrigine, Lamictal for mood stabilization. The tertiary is aripiprazole, Abilify to reduce impulsivity. Dialectical behavior therapy, DBT, is the key alternative, teaching mindfulness, emotion, regulation, and interpersonal skills. Now let's talk about the schizophrenia spectrum disorders. For schizophrenia, primary medication is risperidone, Risperdal, a dopamine and serotonin blocker that reduces hallucinations and delusions. The secondary is olanzapine, Zyprexa. The tertiary is clozapine, clozaril for treatment-resistant cases requiring blood monitoring, family psychoeducation, and social skills training serve as an important alternatives. Next is trauma and adjustment disorders. For trauma-related disorders, sertraline, Zoloft, and paroxetine, Paxil, are primary SSRI that reduce PTSD symptoms. Prazosin, Minipress helps with nightmares. Trauma-focused CBT is a highly effective alternative intervention. Now, let's talk about the NASW ethical responsibilities. Social workers have ethical responsibilities to the broader society by the NASW Code of Ethics, including promoting social welfare, public participation, and addressing issues like pill mills, over-medication, and big pharma influence through advocacy. Now, limitations of medications for schizophrenia. Medications for schizophrenia have limitations. They do not cure the disorder, require lifelong use, cause side effects like weight gain and movement issues, and often face non-adherence. They also do not fully address social and cognitive functioning. Alternative treatment for schizophrenia is an effective alternative is cognitive behavioral therapy for psychosis, CBTs. It helps clients manage hallucinations and delusions by reducing the stress and improving coping skills. When combined with medication, it enhances adherence and quality of life. Now let's talk about the evaluation and conclusion. We evaluate treatment through symptoms reduction, adherence, fewer hospitalizations, and improved function. In conclusion, while medications are essential, combining them with therapy in support yields the best outcomes. Social workers plays a vital role in client-centered ethical care. Thank you for listening.